We're now live. You can proceed.
Good evening, everyone. Thank you all so much for joining us tonight. I'm Lynda Hopkins, Supervisor for Sonoma County's 5th District, and as of yesterday, the Chair of the Board of Supervisors. Welcome to our COVID-19 community briefing for Wednesday, January 6th. Our focus today will be on vaccinations. But before we get going, we'd like to start with a brief message from Gilbert Martinez from our communications staff for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa donde la Presidente de la Junta de Supervisores del Condado de Sonoma, Supervisora Lynda Hopkins, y la Doctora Mase nos dará una actualización sobre el coronavirus. Esta actualización se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias.
Thank you so much, Gilbert. We want to let everyone know that during this community briefing, we will be taking questions from the public in real time. You can submit questions either by emailing them to us at publicaffairs@sonoma-county.org. Again, that's publicaffairs@sonoma-county.org, or by leaving your question in the comments area of the Facebook Live page. We also want to ask anyone who is joining us as panelists to speak loudly and slowly for the sake of our interpreters. We'll begin our presentation with a brief update from Dr. Mase, the Health Officer for Sonoma County.
Thank you so much, Supervisor Hopkins, and thank you everybody for participating today. Let me just share my screen and pull up the slides. I'm not sure if you can see the slides. Paul, can you see them?
Yeah, we can see them now. Thank you.
Okay, fantastic. Is this the correct view?
Yeah, that works.
Fantastic. Okay. All right. So today what I'd like to do is go over our current status, where we are in terms of our data and our numbers, and then really focus some on the vaccine distribution and implementation plan. So we are, although the blueprint for the safe economy is not actually being or happening right now, we're still in the purple tier per our case rate. Our unadjusted case rate is about 38 new cases per day per 100,000 population. It's about 3 to 4 times what our rate has been about 6 weeks ago. The adjusted case rate is 34.5 new cases per day per 100,000. Our overall county testing positivity is 7.8%, and the testing positivity for the lowest quartile, that's our Healthy Places Index quartile, is 13.5%. We are doing a lot of testing since we started with our enhanced strategies on October 19th. Now we're conducting over 3,000 tests per day with an average of 676 tests per 100,000 residents per day. So about double the testing that we were doing prior to our enhanced strategy. And our testing volume is also almost double that of the state average, which is 362 tests per 100,000 residents per day. So we are getting a factor of about 0.5 to 0.6 adjustment for our unadjusted case rate, which is all really helpful because our case rate is being reduced nearly in half. We have, as many of you know, seen increasing COVID-19 hospitalizations, especially recently, since about mid-November. And clearly this is of great concern. And this is why we are, per the state, back in the stay-home order, is increase in hospitalizations, cases, and a decreasing ICU bed capacity as a region. Right now, as of January 5th, we have 102 COVID-confirmed patients who are hospitalized at this time, the most in the last week that we've ever had. You can see that our ICU capacity was initially quite low. Sonoma is represented by the green line, and the overall Bay Area is represented by the purple line. We had been at a very low ICU capacity until our hospitals recognized that they needed to add staffed ICU beds. So the reason why our ICU bed capacity is so much improved now is due to the work on our hospital's part for staffing ICU beds in preparation for more patients that may necessarily need to be hospitalized or in the ICU with COVID. The small decrease in ICU capacity on New Year's Day was sort of the artifact of a fewer staff beds on the New Year's Day holiday. Otherwise, we're in a pretty good place because our hospitals have created more staff beds than the rest of the Bay Area in terms of region, which is definitely below 15%. Vaccine distribution is happening. We have had the vaccine for about 3 weeks and have been distributing and implementing vaccine very successfully for the past 2.5 weeks. We got the first doses December 17th, and the vaccine is going to our public health department for distribution to partners, to the multi-county hospitals like Sutter, Memorial, and Kaiser, and to CVS and Walgreens for our long-term care facilities. That would include our skilled nursing facilities and our residential care facilities for the elderly. And we're now at the beginning of the distribution of vaccine. To date, we have received about 17,500 doses of both the Pfizer and the Moderna vaccine. And as of today, over 8,000 residents have received the first dose of the COVID-19 vaccine, but this is likely an underestimate as data continues to be entered into the vaccine registry. You can see here that in the gray, these are the Moderna doses, and in the sort of dark gray, those are the Pfizer vaccine doses that have been implemented. Again, we've probably given about 2/3 of the doses of vaccine that we've received. So we're have implemented quite a bit of vaccine in the phase 1A where we are right now. This is a graphic of the basic phases of vaccine allocation. Phase 1A covers healthcare personnel who are at high risk because they have direct patient care duties, long-term care facility staff and residents. These are also the highest risk and most vulnerable populations in our community. And then there are 3 sub-tiers I'm going to go into in just a minute. Phase 1B moves on to adults that are at high risk that are not in any kind of residential care facilities, that are 75 years or older, frontline essential workers, adults who are 65 to 74 years of age with underlying medical conditions, the homeless or unstably housed persons, transportation, and critical manufacturing. Phase 1C then moves on to all adults 65 to 74, adults who are 16 to 64 years of age with underlying medical conditions or disability, other essential workers, water, waste management, IT communications, government ops, falls in this category. And then we'll be in phase 2, which is everyone else 16 or older. Why is 16 the age cutoff? Because the vaccines were studied in those persons who are 16 or older. There are studies being conducted in children under age 16 now, and we should have some new recommendations as data becomes available in that age group. So looking closer at phase 1A, where we are right now, we are in progress with tier 1 and almost through tier 1 at this time. Our acute care hospitals who are on the line with us today have done an excellent job of vaccinating their personnel, all their staff. EMTs and paramedics have also been extremely successful in vaccinating their group. Dialysis center staff, the behavioral health and psych hospitals have received a vaccination from public health and are well into completing their vaccinations. And then long-term care facility and staff and residents are being vaccinated by CVS and Walgreens specialty pharmacies. The vaccine doses are going directly to CVS and Walgreens from the state for this group, and they have begun vaccinating all staff and residents in Sonoma County's 22 skilled nursing facilities and over 300 residential care facilities for the elderly. This will be an ongoing task as one facility after another gets vaccinated, and we'll keep everybody updated on that. We have also started tier 2, that would be our federally qualified health center staff in terms of patient care staff, primary care, in-home support service providers, public health field staff, correctional health employees, other behavioral health staff, urgent care clinic staff, and our community health workers or promotoras. So we have begun this group this week. And tier 3 will be also implemented with specialty clinics, dentists who now are actually been approved to be vaccinators also, morticians, medical examiners, pharmacists, and laboratory workers. We plan over the course of the next 3 weeks along with the state to complete tier 2 and tier 3. We have many groups that have been identified for to be vaccinators, many of whom have already started vaccination. We have, as I talked about, we have medical and nursing staff at facilities and agencies are vaccinating staff at the same facility or agency. That would be like the hospitals and the federally qualified health centers. The county HR, Human Resources, has contracted and has an MOU with the clinical health appraisals and Safeway. We have 11 Safeways in Sonoma County, all of which are getting registered, and will hopefully by Friday start vaccinating this group of people. We also have the Sonoma County Medical Association that is starting vaccinating small practices, solo providers, and dentists. A Safeway will also extend vaccination to community health workers and specialty clinic providers, morticians, potentially dentists, and other groups that are in tier 3. We also have the Disaster Emergency Management Agency that will be vaccinating, again, group by group. And our EMS and our paramedic groups that are also licensed to vaccinate, they can set up vaccination clinics at the fire stations or perhaps in pop-up testing sites as well. As you can see, then we'll extend into phase 1B. We anticipate going into phase 1B as early as the end of January. And that's when we'll go into the age groups greater than 75 or greater, the food and agricultural workers, frontline essential workers, law, fire, et cetera. And then our education and childcare providers, the plan for vaccination of our teachers and staff in our education system is going to be through the nurses that are already employed by schools that will vaccinate their own at different locations across the county that will be announced when we get into phase 1B, tier 1. Tier 2 will then cover the 65 to 74-year-olds with underlying medical conditions or disabilities, and all of these groups that are listed here. And then, of course, it'll be similar vaccine administrators. I forgot to mention that AMR will also join our paramedics and our EMS providers to vaccinate. We'll have multiple different locations that we've already identified throughout the county that will be providing vaccination services for these groups as we go from one to another. And lastly, you'll see there's phase 1C that are listed here, I've already discussed. And then the progression of the phases and tiers depends on several factors. One is the allocation of vaccine that's given to the county. That would depend upon what the state gives us. And it will be based on vaccine supply. And then also on how many people want to be vaccinated in these different groups. So those are the variables that are still out there for how quickly we can get through phases and tiers. So I guess I'll stop there and turn it back over.
Thank you so much, Dr. Mase. You know, I do want to start just by acknowledging that it has, quite frankly, been a terrible day for our country. So if you're out there feeling anxious and maybe a little distracted this evening, you're not alone. My thoughts and prayers are with all of our representatives in Washington, D.C., with their staff, with the Capitol Police and the Guard, National Guard that is tasked with securing the Capitol building today. On that note, you know, I also want to note that I am very thrilled today to be introducing kind of a new way of communicating with the county. Our goal from now going forward will be to introduce you every week to a panel of experts as well as other governmental partners. This will provide you with real-time information, not only from the county's public health, but also with other local health experts from outside of county government. And we're also going to be joined by various other government agencies and partners. So I'm thrilled today to introduce our first panel, which will include City of Santa Rosa Mayor Chris Rogers, as well as Dr. Michael Schulman, Kaiser Permanente's physician-in-chief. We also have Dr. Chad Krilich, the Chief Medical Officer for St. Joseph Health in Sonoma County, as well as Dr. Jason Cunningham, the CEO of West County Health Centers. We also have Carly Sullivan from Health Services. You already heard from Dr. Mase. Director Barbie Robinson, Director of Health Services, is also here, as well as Dr. Baldwin. So first, I would like to welcome Mayor Rogers, and thank you so much, Mayor, for being with us today. And I know it's been an unsettling one, I'm sure for you, and I know that you have many friends in Washington, D.C. as well. But trying to take a positive note, do you have some thoughts on how the community can better build partnerships to make the rollout of vaccines more effective, and ways that you see potentially local government partnering together in order to make this a successful effort?
Yeah, no, thank you so much, Supervisor, and thank you for including the city in these conversations. I think one of the hallmarks of COVID over the last 10 months has been this overwhelming feeling of wanting to help and not knowing how to do so, and being able to just cheer on our health providers and our other first responders, while many of us have to stay out of the way and work from our kitchens and work from home, and really help them by not going out and following the health guidelines. What I really see with the vaccine is a chance for us to sort of punch back as a community, and for folks who have for a long time wanted to find a way to help their neighbors to come out of this stronger, to partner to deliver the vaccine as we build the apparatus for delivery. I'll note, and I think that Dr. Mase has talked about it before, so far California has had about 1.29 million doses of the vaccines arrive, with another 660,000 that are on the way. We know that in Tier 1, there's about 3 million folks who will qualify, and Tier 2 is about 8 million. And so I can only hope that we receive those vaccines fast enough for us to need to have a comprehensive effort to push them out as quickly as possible. And I'll note that Napa County recently sent out a alert message to their community to really make sure that they had retired health professionals or others who were feeling as helpless as many of us have an opportunity to step up and to help. And that's really where I wanted to start with this conversation, is a focus on helping to enhance the county and building the apparatus to deliver these vaccines as quickly as we get them, so that we can get our community back to normal.
Thank you so much, Mayor Rogers. I really, really appreciate that. And I look forward to working with you to make sure that we're getting that information out to all of our communities as quickly as we possibly can. And I also just want to say thank you so much. I know that you have someone who is very near and dear to you, who is part of our healthcare system. And so I know it's been, I'm sure, a challenging year for you personally as well, perhaps worrying about a loved one who's on the front lines.
No, thank you so much, Supervisor. And she's actually hopefully coming home soon. I know that she was on shift most of the day. And I think that there's many of us in the community who have watched our loved ones put themselves in harm's way and have been trying to take it really seriously to make sure that we're not making the system work worse and more strained. And as I said, I'm really looking forward to the rollout of the vaccine so that we can help to enhance and be a part of the solution here locally.
Well, I look forward to being part of the solution with you. Thank you so much, Mayor Rogers. Now I'd like to ask Dr. Mase and Dr. Baldwin a couple of questions about the rollout of vaccinations. I think that there's a lot of confusion in the community over, who, what, when, where, how. And really, I'd love to hear from both of you, what is the role of the county in terms of distributing the vaccine versus what are the roles that hospitals and other entities play in that vaccine distribution, so that folks really know where they should be turning to in order to get that vaccine?
Okay, I'm sorry, now I'm unmuted. Hi, good question, Chair Hopkins. So let me break it down a little bit and go into the county's exact role in distributing vaccine, and then how the county and hospitals are receiving vaccine, and go from there. But public health is notified about how much vaccine we're allocated each week, and then we let the state know which facilities will be receiving direct shipments of vaccine from the state, and then the rest is shipped to public health for storage. And from there, public health collaborates with county partners to distribute vaccine that we're storing to providers and administrators who are unable to receive it directly. That's generally the distribution process. And that happens every week. And the hospitals, the 3 larger hospitals in the county, Sutter, Kaiser, and Memorial Hospital, they get direct shipments from the state. So that does not go through public health. Everyone's working in unison and lockstep to get through the tiers and the phases at the same time. And so when we start to move into larger groups that are patients and members of different health systems, and they have their own primary care providers, we are having conversations and we're actively collaborating with all of our primary care providers on vaccinating anybody, offering vaccine to anybody who wants it. And it's going to be through multiple venues. We encourage you to go to your primary care provider. They know you best. And if you feel more comfortable getting vaccinated in their office, that is perfect. But if there are going to be multiple other ways to receive the vaccine. There will be some vaccine clinics. As people become eligible, you can make appointments for those clinics and get vaccinated in certain designated sites to receive the vaccine. So that's another option. And we are going to work with everybody in the community. We are excited that so many people want the vaccine. So we're doing everything we can to make sure everyone who wants it gets it.
Dr. Mase, do you have anything to add? Or I feel like Dr. Baldwin pretty much summed it up, but feel free to chime in.
Yeah, no, absolutely. I agree with everything Dr. Baldwin just said. Just wanted to add that CVS and Walgreens Pharmacy are also receiving vaccine directly from the state, not through public health. And again, those doses are earmarked for our most vulnerable population in the long-term care facilities.
Yeah, I'm sorry, one more thing. We have also, we will be giving Safeway pharmacies throughout Sonoma County vaccine also, and they will be registered to administer vaccine to people who want to walk in and receive that. So that should be happening within the next week or two. So that's another option for people as they become eligible.
Yeah, and again, that would be, just to be really clear, as people become eligible for the tier system, because we're not at phase 2 where everyone can go in and get the vaccine yet. So we're going through our priority groups, and through our website and in many other modalities, we will be letting people know when they're eligible for their tier, phase and tier to go in.
And I would love to touch on that point a little bit more because, I think that getting into tier 1B is really going to open up a lot of new eligible folks, right? When you're talking about agricultural workers, when you're talking about, those essential workers, grocery store clerks, folks on the front line, we're anticipating that roughly at the end of January. Is that correct? Just want to confirm the timeline. And then I also wanted to check in about how are people going to be checked? Like, how are you going to have to prove that you work in agriculture or that you are an eligible person? Because, obviously we want to keep this fair. We don't want folks trying to jump in line if they are not those high risk individuals. But what's that going to look like?
Good question.
Yeah, if I could just do just one clarification, that is phase 1B, tier 1, right? So it's not tier 1B, but it's actually phase 1B, just the kind of nomenclature that the state is using.
Yes, so phase 1B, our goal is to get there by the end of January, beginning of February. So that is actually right around the corner in just a few weeks. And you're absolutely right, Chair Hopkins, that's going to be a much larger group of people that are going to be eligible for the vaccine. And we plan, again, to ensure those who want to get vaccinated can use multiple venues and options to receive the vaccine, including going to their primary care provider, the vaccine clinics, going to Safeway, using our pharmacies, partnering with businesses to arrange vaccinations on site or in that at least region or area, so it's convenient for people to receive the vaccine. And it'd be great if people can show some sort of work identification or personal identification as proof of being eligible, but we don't want that to be a barrier, and it's not required. So if you fit into that eligible group and you come and get a vaccine, we want you to get it. If you can provide some sort of proof, that's great. And if you can't, we're going to take your word on that and we'll administer the vaccine to you.
Yeah, the goal is simply to get people vaccinated as efficiently as possible.
And it's also worth noting that phase, not tier 1B, also includes educators, right, as well as childcare providers, which is another group that includes a large number of workers in Sonoma County. Thank you so much, Dr. Mase and Dr. Baldwin, for the information. I really appreciate that. Now I would love to turn to our hospital medical officers here and perhaps ask Dr. Krilich a few questions. I would love to just sort of hear from your perspective how you think the rollout is going. Obviously, you have a lot of workforce in your area who have been receiving those vaccinations. So if you could share a little bit, about where you think we are and where we're headed.
Great. Can you hear me okay?
Yes.
Great. Thank you for the invitation, Supervisor, and giving us the opportunity to talk a little bit about our journey as it relates to where we are around vaccinations and where we're headed. My name is Chad Krilich. I'm a family physician by background and been serving as the Chief Medical Officer for Santa Rosa Memorial Hospital and Petaluma Valley Hospital for the past 4 years. And so I would just say, one of the things that's different about COVID vaccinations as it relates to, say, influenza vaccinations, which we've been doing for a very long time, is the importance of making sure, and reference have been made to this, to make sure we get the folks who need to get the vaccine first. And so part of our process within our organization to do that is to get feedback from those healthcare personnel in 1A to know, are you working in the COVID unit, caring for COVID patients daily? Or do you have less exposure to COVID? And so we've used tools to understand what's the role of the healthcare personnel that's working in our institution, where's their job located, and what's their level of interest with the vaccine. And we've had the opportunity to use a tool with which to measure that and understand it, and then get people scheduled for vaccinations. The good news for us is that by virtue of the work, and just to echo what Dr. Mase and Dr. Baldwin have shared around the timeline, I think we're moving in the right direction and heading on a very similar approach from a timeline perspective, being able to get into 1B by the end of this month. And the way that we are able to do that is by the fact that we have been receiving vaccine. We've received, just to try to keep it simple, about 5,000 doses of vaccine combined between Moderna and Pfizer, and we've been able to administer over half of those doses. And actually this week, we're starting to give our second dose of vaccine, as both vaccines require 2 doses. So I think we're moving really well down the path in order to be able to be in a space where we can transition to 1B in accordance with the timeline that Dr. Mase and Dr. Baldwin have outlined. And the work that we'll be doing with our partnering physician group, St. Joseph Health Medical Group, is sending out texts and emails to patients who have primary care physicians within St. Joseph Health Medical Group, and then assessing where do they fall in terms of 1B? Are they a frontline essential worker? Are they a patient over the age of 75? And then getting them scheduled for a vaccine accordingly. So that's a brief overview of where we're at from a vaccination standpoint, and happy to answer any questions folks have.
Thank you so much, Dr. Krilich. And I would love to ask you more, but we have got a couple more speakers to get through, and I want to make sure we have plenty of time for the audience questions at the end. So I would love to ask the same question of Dr. Schulman. You also have kind of an eagle-eyed perspective as the physician in chief at Kaiser Permanente, and I would love to hear how things are rolling out with Kaiser and what you're hearing in terms of the response in the Kaiser community. Unfortunately, I can't hear you. I don't know if it's anyone else, but maybe You're muted.
Can you hear
There
me
we
now?
go. Yes,
Okay,
perfect. Thank you.
Thank you, Supervisor Hopkins, for inviting us to join this important and informative session tonight, and we appreciate being able to participate. So for Kaiser Permanente, similar to as Dr. Krilich just mentioned, our first priority is the safety and wellness and health of our people. And similarly, we have stratified our healthcare workers in phase 1A using a very fair and equitable risk-based stratification algorithm to vaccinate those at most risk first. We've nearly completed all of our employees and physicians vaccinations. We're close to 80%, and we are preparing to launch our phase 1B vaccinations of our patients in the very near future, in accordance with the timeline outlined by you and the California Department of Public Health. And so things are going well. I think I'd just like to share that as we're giving the vaccines, just when we're getting ready to start our second vaccines using Pfizer and Moderna this week. I think one of the key takeaways that I'd like to share is that we were anticipating a lot of patients coming or people coming and reporting side effects from their vaccines. And I think the number one side effect I'd like to report is a sense of relief, hope, and gratitude for our ability to rapidly and efficiently and effectively roll out a vaccination effort. And I expect to have a similar response from our patients once we enter phase 1B.
I love that, Dr. Schulman, and I cannot wait to experience that side effect myself when it's my turn, which is a ways out. But thank you so much for the information, and I look forward to getting some of those audience questions funneled to you. Now I'd like to turn to Dr. Jason Cunningham, who, in addition to being the CEO of West County Health Centers, has also been the co-chair of a group of healthcare providers coming together to figure out how best to communicate out to the public about the vaccination plan. And I would love to hear from you, Dr. Cunningham, how that's going and what you'd like to share of the efforts from the healthcare providers.
Great, thank you so much. What a great group. I guess my perspective, just to be thankful and gracious and that relief and hope is real. I'm incredibly excited about the vaccine. As a family physician, I'm excited for my patients. We care for some of the most vulnerable patients in our county. I'm excited as a leader for our staff. That sense of relief is incredibly important. I'm also really excited for us as a community. I'm nervous and anxious for our children to be back in a community together. I want to have an experience together in worship and to be able to be in community with friends together. I think the idea of being able to get back, as Mayor Rogers was saying, into some sort of normalcy is incredibly important. And this vaccine is our most important tool to get us there. And so I'm excited. I'm excited to get my own vaccine next week and looking forward to that. And I recognize that people have very important and legitimate concerns about the vaccine, both with the way that it's been communicated nationally, the way that the vaccine was developed. People have concerns. And I also recognize that different communities have a different experience of vaccinations and large-scale vaccinations, or they have a different experience with trust in public health and our government. And so I think it's really important for us to recognize that authentic and transparent communication, being able to have dialogue in community, where communities are at, in the culture and in the language or the perspective of those communities is going to be incredibly important for us to be successful. And so recognizing that, Kaiser and Sutter and West County Health Centers and the county public health department are all coming up with very similar messaging around the safety and around how engaged we are around the vaccines. It makes sense for us to do that together, and we'll be much more effective if we can. And to make sure we have the eye of equity, making sure that we're looking at communities of color, those who are vulnerable. We think about the lens of equity from, is everybody going to have access? Is there going to be issues with delivery towards certain populations? populations. And so coming together, I think we'll all look back on this time to say this was one of those times, if we do this well, that we are going to have a big impact on the health and safety of our community, but only if we do that together. So this concept of collective action. So what you referenced is I'm supporting and facilitating a collective action effort with all of the health systems and the county, Paul Gullickson and his crew, Dr. Mase and Baldwin, but also the Sonoma County Medical Association and Partnership Health Plan, HPEACE, the Office of Equity, recognizing that our communication effort needs to be broad and it needs to be in the language and culture of our community. So, so just to say that to me is what brought me into healthcare, brought me into community health, and this opportunity to do this together with really incredible colleagues is where we're at. That will be ongoing throughout this campaign. We're meeting at the pace of change, so we're meeting weekly. We're working with organizations such as The Engine is Red and others to try to elevate and to spread the word moving forward. So I guess that last thing I would say is I would welcome opportunity to provide space for dialogue. And so I think this is a really good example of that.
Thank you so much, Dr. Cunningham, and I will look forward to following up with you after this to talk about how I can support your efforts, which are fantastic. We have one last presenter, and then we will, I promise, get to the Q&A section. So we do have Carly Sullivan, who coordinates the Advanced Life Support Services for Coastal Valley's Emergency Medical Systems Agency. And I would love to hear from Carly, if you're still on with us, what you're doing to try to get the vaccine out to people as quickly as possible. And I do know that there was a very successful vaccination campaign for our paramedics and EMTs, partnerships between local fire agencies and AMR, and would love to hear a little bit about that.
Great. Hi, thank you so much for the opportunity to speak tonight. I also have Brian Cleaver, the EMS Administrator for Coastal Valley's EMS agency, on with me as well. So Coastal Valleys, we serve a role in disaster coordination, which is where the Medical Health Operating Area Coordinator plays a very distinct role on supporting all of our healthcare partners, from EMS to hospitals to skilled nursing facilities, clinics, and urgent cares and specialty care during any form of disaster. So for example, during the COVID-19 response, we have applied and been approved by the state EMS authority to use paramedics and EMTs for swabbing and testing, for antibody blood draws, and now for vaccinations. We will continue to explore ways to use our EMTs and paramedics locally to support any vaccination efforts. This includes the very large effort by all of our paramedics and fire departments to vaccinate last week all of our EMS and fire medical responders, and we'll continue to support that as we move into the additional phases.
Thank you.
And then
so
Brian,
much.
I don't know if you had anything to add.
Not hearing anything from Brian, but thank you so much,
Yeah, sorry.
Carly.
Sorry, Supervisor Hopkins, struggled with mute, and you're right. I think Carly has summarized it well, and I'll remain on the line should we end up with questions. Thank you again, Supervisor Hopkins.
Thank you so much, Brian. And really what I appreciate about what you just said, Carly, is that we have an ability to create surge capacity because we now have local medical personnel who are officially approved by the state who could administer vaccinations, in a mass vaccination campaign, which I think is a really positive benefit for our entire community. Well, thank you so much to the panelists for answering my questions. And I will be handling it back over to Paul Gullickson, who has been tabulating all of the questions from the community to try to hit the top ones and funnel them to the right people.
Thank you, Chair Hopkins. We do have quite a number of questions from the public, and we have some media partners with us today. We'll start with some questions from the public. The first one, we'll get to some questions about vaccines, but the first one that's on a lot of people's minds are concerns whether we will be extending our stay home order past this week. Our stay home order is expected to expire on the 9th. And we have a number of business owners who are trying to figure out what their plan should be for next week. Dr. Mase, do you want to address that one?
Sure, thanks, Paul. So we will still be under the state stay-at-home order when our county order that was in place prior to the state's order expires. So at this time, from the state's projection and the regional approach that they're using for determining how long to have the stay-home order in place, we will likely be in the stay-home order for a longer period. Our ICU bed capacity as a region, as I showed in my presentation, remains under 15%. So I would tell people to expect that we will continue to be under the state's stay-at-home order.
Yeah, and I expect the state to be announcing soon on that for the whole region as well. Thank you for that. So on the area of vaccines, we have a number of questions about people, just the uncertainty around when they can expect to get their shot. For example, Ashley asks, she notes that she's in Tier 1C. She knows that for the vaccine, but she wants to know, how am I going to know when it's her turn to get the shot? And we have many other similar questions along that vein.
Yeah, so we plan to have that on the vaccine homepage at socoemergency.org, and we'll be updating that to notify people when their group comes up for vaccination. But that's not the only way we'll get that message out. We will work very closely with Paul Gullickson and the communications team to ensure that we're getting that message out to everybody in different ways through different media. I don't know, Paul, if you want to add at all to this.
Yeah, I appreciate you bringing that up. We are updating our vaccine on socoemergency.org. We have a whole component focused on vaccine information and vaccine distribution, and we have a graph showing where we are in the rollout of these phases, and we'll be having some new data up showing the number of vaccines that have been administered. And so that's we are updating that with as much information as we have available. So we hope to make that. We encourage people to go to socoemergency.org to the vaccine pages for that information. Let's go to Julie Johnson from the Press Democrat. She had a question for us.
Hi,
Julie?
Thank you so much. This is actually a question for Dr. Krilich. Your hospitals have received added staff from the National Guard and local firefighting agencies through Cal OES. And I wondered what this means about the pressure on hospital staffing during this pandemic and what you're bracing to take place as cases continue to rise.
So, having been down this road before, we obviously, want to make sure we've got good strategies and tactics in place to make sure that we're not only able to care for the community here in Sonoma County, and at the same time being a regional trauma center, it's very important that we have staffing to be able to serve the community here and outside. And so to that end, we do use tactics in partnering with the county and coming up with ways with which to make sure that we've got appropriate staffing. And we have and will continue to use that as we see fit to make sure that we're able to continue operations. And so I think it's important to emphasize the things that we know that reduce the likelihood of spread of COVID. And, I think everybody knows this, but I'll just say it again out loud, right? It's the hand washing, it's wearing the masks, it's being distant. And then when your number comes up to get vaccinated, is to get vaccinated. I would just like to echo what's already been said by Dr. Mase and Dr. Baldwin and Dr. Schulman, as well as Dr. Cunningham. The experience that we have had in seeing the looks on people's faces when they get vaccinated is not anything I've ever experienced in healthcare. And I think just really looking forward to moving this work forward and having conversations that come up as they do around the vaccine and its safety and its efficacy. And so really looking forward to having those things in place to be able to respond to what we're currently seeing.
Okay, great. And let's go to Carrie Benefield. Carrie, you had a question as well.
Yeah, thanks everybody. I guess this is for Doctors Mase and Baldwin. Kind of following up what you talked about on Monday is I'm wondering if February 1st is an accurate or as close as we can get to when educators, school staff may be getting their vaccinations. Just in speaking with you guys this week and Dr. Harrington, is that a good number, February 1st?
You know, this is a moving target. Again, it depends on a few variables that are not completely under our control. That is how much vaccine we receive from the state. That's one. So we'd like to hopefully have an ongoing allocation of vaccine. And second, in the tiers that come before educators, how many people want to get the vaccine? If everybody wants it, then it might take a little longer. So I don't think we can put a date or a time on it, but we're hoping that by the end of January, by February 1, that we can get to that group.
Great. And as a quick follow-up, hopefully, are there any details that you can provide about the actual distribution? It's about 9,000 people that fall in that category of educators and staff. Is it going to go through SCO? Is it through district offices? Is it through private providers for those staffers? What is that going to look like?
Well, I just got off a call with SCO and Dr. Harrington, and we're working closely with them on a plan by which hopefully we can set up places around the county, maybe even schools, specific schools that Dr. Harrington and group choose where that vaccine administration can happen. But we'll have a plan in place as to who's going to vaccinate and where it's going to happen, and get that out and hopefully seamlessly go through that group of 9,000 people.
Okay, thanks very much.
Okay, thank you, Carrie. We have a few questions related to tiers, I would say. Dina asks, what about the elderly who are not in skilled nursing facilities? Perhaps those who would live at home, our seniors. When can they expect to get the vaccine?
That's a great question, a question we've been asked often lately. And anyone who is older or elderly that's living in the county that do not reside in a long-term care facility, if you're 75 and older, you're coming up next. After we work through phase 1A, that's a priority group in phase 1B. So again, as Dr. Mase was saying, our goal is to get to phase 1B end of January, beginning of February. So 75 and older, that should be about the timeline, end of January, beginning of February. If you are 65 to 74 with an underlying medical condition, that is the second tier of phase 1B. And I know this is getting very, very confusing on the phases and the tiers, but essentially that group comes about the same time, maybe a few weeks after the 75 and older. So we would say probably mid-February.
And you should be able to, Nepal, you can mention too that they can go to the website to see specifically who is in which phase or tier to know what the prioritization is.
Yeah, and if they go to socoemergency.org /vaccine, that will take them directly to our vaccine pages where they can see those tiers. So thank you for reminding me about that. We had Rebecca asks, we know we've had some reporting about outbreaks at some of the jails in the North County. She asked, is the jail staff eligible for the vaccine yet? Does anybody know?
Yeah, Dr. Baldwin, do you know when jail staff are up for vaccination?
I'm sorry, I was trying to unmute there. Yes, correctional staff are up in phase 1B, that tier 1, that is in frontline essential workers are included in that group. So they will again be in really the next few weeks. The they'll be eligible for the vaccine.
Okay, excellent. We have a couple of questions I sort of grouped in the storage area. One question is from Lacey asked, has Sonoma County had any issues with having doses and vials having to be tossed out because they didn't have anyone to administer? We've heard of episodes like this in other areas. The governor apparently discussed this on Monday. And will there be lists for those who you know, if they do have a need to administer doses right away, that they can call on to get vaccinated? I guess that's the question. They want to be one of those lucky people like up in Ukiah that got vaccinated early.
No, we have not heard of any doses having to be discarded or wasted from any of our administrators or providers of the vaccine so far. And we have been encouraging partners that we're working with and everyone that we're talking to, if they're having an appointment system, to have a couple of standby appointments. So they may not have made the actual date and time, but they're on standby. So if there are extra doses or somebody doesn't show for their appointment, somebody can be called and then they'll come in and receive that dose. So that's what we're encouraging people to do as well. So doses do not get wasted. We don't want that to happen in any way. We want every dose to get out to somebody who wants it.
I don't know if any of our hospital partners might want to weigh in on that. Have any of you had any issues about dosage not being used? I expect not.
Hi, this is Michael Schulman from Kaiser Permanente. We have not had any issues with waste of any of the doses.
Yeah, I expect that.
Yeah, Chad Krulitch here, very similar. I would just like to echo Dr. Baldwin's comment. I think one of the things that we learned early on is, you know, in the process, making sure you've got a backup list of folks outside the schedule and then just taking advantage of that when there's times where we're able to get more doses. More specifically out of the Pfizer vaccine, we've been able to reach out to healthcare personnel to get them in so that we're making sure we're making good use of our supply.
Great. Well, we have had other questions about the preservation of that, you know, cold storage chain. And one question comes from Miriam. She asks, is Safeway going to be able to keep the Pfizer vaccine viably cold during the administration process? That's a good question. Does anybody know how that's going to work?
So from our conversations with Safeway, first of all, there's two levels of maintaining the cold chain. Number one, in the freezer, which it can stay in, you know, both of the vaccines can stay in the freezer for months. And then once you take it out of the freezer and it's refrigerated, for the Pfizer vaccine, you have about 5 days to use it, what you've taken out. And then you've got about almost 30 days or about 30 days to use the Moderna vaccine. The Safeway pharmacies do have the refrigerators. So they will be able to, you know, keep what they're receiving in the refrigerator. And if it's Moderna, they'll be able to keep that for 30 days and administer a vaccine to people as they come in over that time. And if it's Pfizer, it would be about 5 days to administer that vaccine to people who come through. So yes, they can maintain the cold chain. They're just at the end of it. They're able to keep it refrigerated, and they're well aware of the time limits for how long it can stay refrigerated before it has to be administered.
Great. Another question just concerning capacity. The question is, does the county feel like it has enough capacity to administer the vaccine at the rate that we are receiving the doses? Or do we feel we need to build excess capacity to meet that and to reach out to perhaps different resources to help with that?
Well, that's exactly at the point we are now. We're reaching out to multiple different resources for vaccinating. I think in my presentation, I went over numerous different groups that have stepped up to help vaccinate. And we're really pleased to note that dentists have been put into the group of vaccinators as of yesterday and given approval to vaccinate. That's a huge group of vaccinators for our county, and we will be tapping them, as we are EMS, paramedics, Sonoma County Medical Association volunteers, the Department of, the DEMA staff, which are emergency management staff, the Medical Reserve Corps. Once they get vaccinated, they'll be able to vaccinate other people. And we've also been asked to submit a request to the state of California for any other support that we need. And we have submitted a request for an additional 50 vaccinators and 100 support staff. So we're waiting to hear from the state when and what timeline and when we might be expect to receive that kind of support from the state. It would be sort of like OptumServe is doing testing and they're a state-run facility. I presume that it will be similar to that in terms of support from the state. So I'm hoping that we'll have that channel as well.
I just also, I wanted to add and give a big thanks to individuals who have reached out to us and, you know, volunteered to be, well, volunteer vaccinators. And we've got their name on a list as well. So we really appreciate that. We've had some nursing agencies who have reached out to us and are willing to help vaccinate people in the community. So we are compiling the list. The list is getting longer, thankfully. And we really appreciate all of the people who are reaching out to us to help out in administering the vaccine within the community.
Yeah, we certainly have heard more from people who want the vaccine than when people want to avoid it. So that's certainly an encouraging sign. Just a couple more questions. I know we're getting to the top of the hour, but one simple question from Kimberly asks, will the public get an appointment to come back to the same place for the second dose as they got the first? Or if that's a problem, is there another place they need to go or should go to get the second vaccine?
Yeah, you know, actually, let me answer that. And I think if Josh is still, Dr. Weil is still on from Kaiser, he can address what Kaiser is doing. We would actually like people to go back to the same facility where they got the first dose for the second dose, because their records will be there and it may be an easier, more seamless process. And the second appointment should ideally be given when the first appointment is made so that people are really clear when they go back. Having said that, we also want to have some flexibility in the system. So there are cards that will be given that come with the vaccine. When the first dose is administered, you should receive a card stating the date of administration and which vaccine it was and when you need to get your next appointment. So if there is an issue with going back to the same place as the first dose, it should be okay to go to a different facility that works out better if that's a need, and show them a card and get the second vaccine. So that's what we're envisioning. We prefer sticking with the same facility, but we'll have flexibility. I don't know if Dr. Weil wants to speak to Kaiser's approach.
Actually, I think that Dr. Schulman is here on behalf of Dr. Weil, who couldn't make it.
That's right. Sorry, Dr. Schulman.
Yeah, thank you. Yes, at Kaiser Permanente, our patients will get their second vaccination in the same location, and they will be given an appointment for their second vaccination at the time of the first vaccination. And that is our plan.
And our last question tonight, we really appreciate everybody who's posted questions. There's a really good, we hope to get back to you if we are not able to answer them tonight, but really has to do with the capacity of our hospitals right now. And just a question is concerning overall about what is our capacity in our hospitals. Is it being taxed? And if so, do we need to have overflow capacity similar to what we set up in the summer at Sonoma State for that surge? Do we need to start tapping into surge capacity, I guess, is the question.
Paul, did you want to have the hospital representatives speak?
Yeah, maybe we could start, maybe Dr. Krilich, you could start with answering that, how we are doing. People are concerned about how our hospitals are doing in the midst of this latest surge. You're on mute. You're on mute, Dr. Krilich.
It's not a Zoom meeting without somebody saying you're on mute. Guilty as charged. Somebody can score their bingo card accordingly. So yes, as it relates to managing surge capacity, right now we're in a position where we're not having to use surge beds. That being said, when you look at our volumes compared to, say, where we were in August, we had not really been in a place where our COVID volumes were above 10% of our total number of patients in the hospital. And we've been in a space where it's around 20%. So it's something that we look at daily. I think at this point, in partnership with the county, we'll continue to assess it. I think, the message remains the same in terms of decreasing the likelihood of, getting to the space where our colleagues in Southern California are, where, many of our sister hospitals there are in a space where the inpatient capacity is not 20%, but actually 50% of the beds in their hospitals are occupied by patients with COVID. So we'll continue to obviously keep an eye on that and partner with the county and the other health systems as to managing to it.
Great, thank you, Dr. Kilic. Dr. Schulman, do you have an update for us on that front?
Yes, thank you. Similar to Dr. Kilic, we monitor our capacity in the hospital daily. We currently have not activated our surge plans, and we're thankful that we have not had to do that. We also partner very closely with all of the Northern California Kaiser Foundation hospitals, and we move patients as we need to support the entire Northern California region. And we too will continue to work closely with the county, as Dr. Kilic mentioned that he does as well. Thank you.
Great, thank you all. And I'll turn it back to Chair Hopkins.
Thank you so much. And we're going to end our session here, but I really want to thank all of our panelists for joining today. And I especially want to give a thank you to the crew that helped put this together, all of our public information officer team, as well as Jordy, our Spanish interpreter, and Elizabeth, our ASL interpreter. It's also the time to promote the county Facebook page and to follow us on Twitter if you want more information, and try to join us again, please, each Wednesday for these live briefings at 5 p.m. But I'd like to actually give the parting words to Mayor Chris Rogers and say thanks again so much for joining us, Mayor. Take it home.
Thank you so much, Supervisor. I really appreciate the invitation, and we are just so thrilled to be able to partner with you. I did want to leave, as I listened to the questions and as I've talked to folks in the community, I did want to leave with one additional suggestion, and that perhaps you and I can talk about offline, and that's a better utilization of our SoCo emergency and Nixle alerts to possibly notify folks of when their category comes up. So for example, I heard the question of educators. Perhaps when it becomes available for educators in early February, we can notify the community through those alerts, as well as how to get signed up. And that'd be a level of coordination that I'd be happy to talk with you about and to see how we can move forward, because that does sound like there might be some value there. And outside of that, thank you so much for having us, and we look forward to partnering.